It's alive, it's beating, it's the nerve center of news. It's the Pulse on the JoyNews channel. We're coming to you live from our studios in Kokomlemle on your digital terrestrial TV because, of course, we are free to air. On DSTV, we're on channel 421, and on GoTV, it's channel 144. Remember, we are your home of independent, fearless, and credible journalism. This afternoon on the Pulse, as many as 11 persons died in one day from COVID-19 complications here in Ghana. That is according to the latest data on the virus released by the Ghana Health Service. We'll have a conversation on this matter even as the WHO says 8 in 10 African countries will miss the crucial COVID-19 vaccination goal.
Every hour, 26 Africans die of COVID-19. The pandemic is still raging, and we must not let our guard down.
Open our border, the cry of residents of the western regional town of Elubo protesting the closure of the land border there. We'll hear from the MP for the area who says government has failed to heed their calls.
Our goods are spoiling and everything is getting apart. We have collected loans from banks and we can't pay.
Doing this demonstration because it's been almost 2 years. Our people at the border towns are.
Also this afternoon, several roads in Accra and Kumasi rendered unmotorable with huge gridlock after close to 6 hours of rainfall. We're going to speak to our reporters and hear from some motorists. We'll take you live to the northeast region as well, where 11 people have died following days of flooding in that part of the country. My name is Kojo Yankson. You're very welcome. Thank you for joining us.
What's up, guys? My name is Sammy Forson, host of the Weekend City Show and Ignition right here on Joy 99.7 FM. Well, anytime you happen to be busy and you miss out on your favorite shows right here on Joy FM, here's what you can do. Log on to myjoyonline.com/podcast. Just go on there and you'll find all your shows on demand 24/7. There you can catch up. Remember, Joy FM remains your radio for discerning listeners.
Joy 99.7.
Right, let's get started now. As many as 11 persons have died in one day from COVID-19 complications here in Ghana. That is according to the latest data on the virus released by the Ghana Health Service today. Despite the increasing number of deaths being recorded in the third wave, there are many Ghanaians who have thrown caution to the wind and are going about their activities as though there is no pandemic in place. Today, we will look at the country's COVID-19 situation, including the cases on admission, especially those on ICU wards. We're going to do that shortly, but first, let's start with the current case count. So we now have recorded since the beginning of the pandemic 119,436 cases. 1,036 of them have died. 11 of them recorded in the past 24 hours. We have 482 new cases with 7,151 active cases across the country. You can see the hotspots marked on the map of Ghana, and as always, Greater Accra and Ashanti regions leading the pack. Okay, let's talk about it. I'm joined by Dr. Christian Owu. He's a senior lecturer at the University of Ghana Medical School. He's the head of ICU at Kolebu Teaching Hospital and the National Case Management Coordinating Member in charge of severe and critical cases. Doc, thank you for your time. Now, how exactly is the country's COVID-19 situation looking from the perspective of the critical cases we're managing? If we can have you unmute your microphone for us, please.
Yes, thank you very much, Kojo. And good afternoon to your viewers and listeners. Yes, we are still in the third wave, okay? So we still have significantly a good proportion of people getting infected daily. As you can see on the Ghana Health Science dashboard that you show to us, the daily count of infections have not significantly started reducing. We are still doing an average of 500 to 600 new cases every day. As we've said multiple times, the proportion of people who would become severely or critically impacted by this disease is a proportion of the new cases. So as long as that continues to stay up, we're going to continue to have a significant proportion of people hospitalized in hospital who are requiring intensive care or some high care units intervention. That number is still quite up there.
So let's take us into the ICUs. Tell us what the situation is. Are we having a strain on the resources of intensive care units across the country at the moment?
Yeah, we from the very beginning, this is an extra burden on what we already had from both infectious and non-communicable diseases in our country before COVID-19 came. So there's been a strain that has not abated from the very beginning. Yes, there have been waves with periods where the numbers had gone down, but it means that we still have had to repurpose sections of our hospital system towards treating one disease. And remember that this has not removed the other burdens that are from other diseases, both infective and non-infective, that the hospitals had.
Yeah.
And the longer this goes on, the weaker the health system would become because of the difficulty in maintaining peace with its injurious effects on our health system and other interventions for other patients.
How much of this is down to the Delta variant?
All right, so I cannot from my fingertips give you proportions immediately, but what we know is that the Delta variant globally has been with us now for at least 3 months or even a bit longer than that. It basically means that as it spreads in the community, if that is the new variant, it gradually becomes the predominant variant. So we would be expecting that it's gradually becoming the predominant variant in Ghana. I do not have the exact proportions. But what it means is until we're able to bring it down to very, very significant numbers, it will continue to spread. We have not removed the environment. We have not removed the circumstances that stops it. There's still significant non-adherence in our population. There is still significant proportion of our population who are yet to be vaccinated.
So, I mean, you talked about the fact that we would always have a certain proportion of cases being severe and requiring hospitalization. That proportion hasn't really changed since the beginning of the pandemic. If I'm right, it's somewhere between 10 to 15%. If that is the case, that means we could have quite easily predicted the situation we are in today. We can quite easily predict the numbers from one day to the next. Are we making use of that predictive ability? Have we planned around the allocation of resources? Have we done anything at all to increase the capacity of ICUs across the country as a result of these predictions?
Yeah, thank you, Kojo. Yes, this is the third wave for those of us in Africa, most part of Africa. In actual fact, some parts of the world are already in their fourth wave, and it's already coinciding with our third wave. And some of us think that is probably a reason why this may plateau for a bit of a time. But yes, the modeling and ability to predict is already there. We've known what the percentages are or who are requiring ICU. But ICU is not a building. ICU is a practice. Critical care is a practice. If you do not have all that prior to the pandemic and you've not been had a significant let off of the pandemic, it's quite difficult to say you're going to build new ICUs and then populate them with equipment and more importantly, human resources. A lot has been done in case management wise in trying to repurpose and more importantly, increasing the capacity of the workforce to handle severe and critical cases. And that is part of the reason why the impact on our population had been minimized. We are continuously doing training, basically helping set up new HGUs in places, high dependency units in places where they were not available previously. As we speak now, I just finished with my colleagues a training of another center that is restarting, that is basically starting a high dependency unit just yesterday. It's a continuous process. But if you remember what I said at the beginning, it's not as if it just started. It's been 18 months of not letting off. Eventually, we would have to keep pushing. If not, you have a situation where the strain on the health system is so much that irrespective of which country, irrespective of how rich the country is, you may not be able to withstand that. Now, the other part of the question you asked about the proportions, what we realized with the first two waves and those variants were that Africa had an extremely low effect on our continent, but that is not the story with this particular wave. If you looked at the data that are coming out globally, for the very first time, Africa had continuously on a daily basis contributed between 5 to 15% of daily new cases. At a point in time, we're contributing about 10 to 12% of new cases, as against previously when we're contributing between 1 to 2%.
Yeah.
With respect to the number of people dying, Africa is currently contributing roughly between 8 to 20% of new deaths. If you look at yesterday's mortality, it's roughly about 8% of all mortalities in the world. So no, as we stand now, Africa is not being spared. Our populations are not being spared. So with the number of infections in this particular wave, if you did the mathematics, you realize that mortality or number of deaths is much more than it was compared to the number of infections with other waves. And this is not letting off just so easy. So we need to continue to put in the efforts to reduce the impact on our population. And adherence is a strong one to go after.
Right. So, I mean, you've talked about the fact that the modeling exists. So let's make use of it. We just started the month of September. Are these numbers going to get worse?
All right. So we just started the month of September. Usually, from the two previous waves, usually by the third month, you would have your numbers coming down. So if you, let me just give you an example of what happened with the second wave. The second wave started picking up at the end of December. We had a full blast wave, mainly in January, February, and early part of March. By April, our numbers started coming down. And this is because a significant proportion of the population is infected. Then, because there is a bit of natural immunity, which we have recognized to last roughly up to about 3 months for those who are able to mount up natural immunity. It means that during that period of time, they may not be reinfected. But beyond that period of natural immunity, they become candidates for infection, another infection. And that is why, although at the end of April and majority part of May and June, we had very, very low numbers. That gave us the time, that brief period where another 3 months after that, it's basically as if the population had never been infected. And you have another wave rising up. Now, how do we go after that? That is where, with respect to vaccination, most countries were very aggressive including ours, to try to vaccinate as much as possible to get to the point where it's not just the natural immunity that wears off roughly in about 3 months, but there is the added immunity that is even much more effective from the vaccine that lasts a bit longer to bridge that gap of not allowing us to have another wave. But I also mentioned that we do not live in, we are not cocooned in a country with no ins and outs. So most of the previous waves followed a trend where all of us from different parts of the world, just a period of about 4 to 6 week difference. And almost every part of the world would go down and then another one starts. But unfortunately, now we are having countries like in Africa where they are in the middle of their wave or we're hoping to be coming down in their wave, coinciding with the US, the Northern America, and Europe now starting a very strong fourth wave. So if you look, US is recording an average of between 150 to 200,000 new cases every day. You've seen the same thing in Western Europe and parts of Asia and Middle East. So it basically means as long as we are an open environment, communicating and traveling around that, we would continue to import some of those cases. And it's not so easy to say that then we have to shut ourselves off, because the meaning of that, we have all seen the consequences that comes with that.
Right. So by way of a specific answer, in the month of September, these numbers will go up. It will get worse in the month of September before it starts to get better.
It doesn't look like it's going to come significantly down in the month of September. The numbers we're looking at the moment is still on a daily basis, about 500, 600 new cases. We expect that most of September is going to be the same. We estimate that if it's going to start coming down, if we're going to be spared a bit, it probably will be beyond September.
Let's position our situation in the global context. So across the continent, according to the WHO, 8 out of 10 African countries are not meeting their targets when it comes to vaccination. Now, the issue here is that we are the continent with the fastest growing population and the continent with the worst healthcare provision. So looking into the future, is this pandemic likely to end up having African countries like Ghana cut off and isolated from global movement, as we've already seen some countries elevating many African countries from amber alert to red alert status so that you cannot travel to their country from here? Are we going to see more of this? Is Ghana likely to become a country that is isolated from the rest of the world?
Right. I mean, those are geopolitical issues that I'm sure there will be a lot more discussion. But let me say, categorically, there's hardly any country that is meeting their vaccination targets because of the unpredictability of this. You're already hearing about the requirement for some vaccines to have a third shot, and even whether we're going to have regular shots. Now, again, there is the seasonal flu that you find in Europe and then most part of Northern America, where every year people have to get their jabs for that. Whether COVID-19 is going to become one of those, we do not know fully. We've had too short a time to decide that. Countries would always attempt to protect their population, especially when they have vaccinated enough and have it under control. And that's why I said that is geopolitical. There's not a lot you can do about that. If we had the situation where majority of us are self-sufficient and then we had our infection under control, we probably will be doing the same. So this is more of a challenge to us in Africa to rather prepare to reduce this significantly while we are aggressively pursuing vaccination. Right. The good thing about this is not an African problem alone, like you had with some of the other epidemics, like the dengue and then the Ebola and a few others, where we are totally at the mercy of others. Vaccines have been found already for this. This is the fastest that ever occurred in the world. There are discussions in Africa in producing vaccines, and that is a very good discussion to also pursue to make sure that we are, to some extent, self-sufficient in protecting our population. But yes, issues with travel are going to happen. Countries, and these are because countries are trying to protect their population, not necessarily because of it is Africa. We are not the only countries in amber or red alert. Actually, look at the UK amber and red alerts. There are more of the European countries and other countries in Asia which are significantly in that. So it's not based on discrimination or racial discrimination or the fact that we're Africa. But of course, if everybody else sorts this out and this become an African problem, like we have as malaria or any of the others, and we do not deal with it, then that's that is a problem that we would have to deal with because we would not expect that people would continue to focus on our problem and while they also have their own problems to deal with. And that is why we are significantly saying that we need to enforce adherence. We need to make sure that we reduce the population that are infected while we encourage people to take the vaccines. Yes, we are seeing larger numbers on the queues for vaccine nowadays, but I can tell you that there are still significant population, part of our population who have refused to take the vaccine, including the young and the elderly. And we need to continue to do the communication, the risk communication that is associated with this to reduce that. If not, it will be our problem to deal with.
Right. With this uncertain future looming ahead of us, Ghanaians, sadly, are still not doing very well with the protocols. We're not abiding by them. Beaches and nightclubs are still filling up, and people are not wearing their masks in public and in enclosed places as the protocols require. So as a person who is managing some of our most serious cases, when they are at those critical stages, what would your word of caution be to Ghanaians who are watching you right now?
I think we've said significantly many times that it's no longer an issue of whether people die from COVID or not, or whether it is only those who are elderly or those who have comorbid conditions or chronic medical conditions, as we call it. With respect to the variant wave, the Delta variant, we have seen significant number of people under the age of 40 who had ended up in intensive care units, and some who have lost their life, not because they had comorbid condition, but because as viruses mutate, they become more difficult to treat, they become more difficult to control. They learn our immune system also, the same way we are trying to learn how to control them, they learn how to evade us. And with time, it becomes even much more difficult to handle. We are seeing the numbers on our dashboards. The number of people dying are not coming down, and that's not because a lot is not going into trying to treat people or control it. Adherence is important. We have said, and we continue to say, that people should continue to avoid gatherings. And if for any reason they have to be in any gathering or they have to be go out, that they should wear their masks and wear them well, handle them properly. We continue to encourage people to wash their hands and make sure that they do not continue to contaminate their hands and then transferring those illnesses to them, the virus to themselves.
Right.
But also remember that a lot of people work in offices, and these are hotspots for infection. And it is important that you protect others by encouraging them to wear their mask, because you are protecting yourself and your family. Yes, I agree with you that a lot of people are behaving as if it is gone, probably because the person has not lost anybody in their family. But you don't need to lose somebody in your family to be wiser.
Yeah.
And that is important. The other aspect is enforcement. I think that the agencies that are responsible for a force need to be up to their game. I think we can't continue to leave people to put other people at risk. The elderly are still significantly being affected by this.
Right.
We need to enforce those policies, those protocols, because they are as good as law in our country. If not, we would have difficulty in controlling the number of people who are going to be severely ill or the number of people who are going to die.
Dr. O, I thank you very much for your time with us this afternoon. That was Dr. Christian O. He's a senior lecturer at the University of Ghana Medical School, at the head of ICU at Kolebu Teaching Hospital, and a National Case Management Coordinating member in charge of severe and critical COVID-19 cases. Meanwhile, the Ghana Health Service has taken delivery of sequencers, which will aid in the identification and monitoring of COVID-19 variants. Now, as we speak, Ghana's COVID-19 deaths have crossed a grim milestone, with over 1,000 people killed as the country battles a third wave driven by the deadly Delta variant. Director General of the service, the Ghana Health Service, Dr. Patrick Kuma Abuaji, says the new equipment will help the service improve detection and treatment of COVID-19 variants.
At the beginning of the pandemic, as a service, our drive was to ensure that we don't just fight the virus now, but also prepare for the next one. And so as part of our response, we ensure that we built in capacity so that we'll be better off now. And I can say that our response, our preparation is much better today than in March last year when we saw our first case. And this has not happened this has happened with strong support from CDC and other partners. CDC has helped us establish our national EOC, helped us establish regional EOCs, and then we've also expanded our laboratories. When we started with COVID, we had only 2 labs, academic labs. Our objective to ensure that by the time we finish with the response, we are also ready as a public service, be able to, all the time, be able to work well to identify emerging diseases, get this, the serotypes that we are getting so that we can respond better. We've been doing this with meningitis, but this has helped us now. So with the support with the molecular labs and the EOCs, we are now going to do sequencing. And so we are able to always be on top of whatever we do, and then we can also tailor our messages, our responses into the need of the current system. So I want to use this opportunity to thank you for this important support that really goes to improve our capacity to respond. This support also helped us give the regional capacity has expanded so that they do not have to wait for the national level instruction, but they are able to tape up responses and also act as quickly as they need be.
Now, the World Health Organization has revealed that a total of 26 Africans die every hour in the wake of the third wave of the COVID-19 pandemic, and is urging support to the African countries to help revamp and ramp up efforts to vaccinate more people within the African continent. Let's listen to Dr. Matsidiso Moeti, WHO Regional Director for Africa.
24 out of 54 African countries, so nearly half, are still reporting high or fast rising case numbers. The epicenter is a moving target, shifting from one sub-region to the next. Cases are rising in West, Central, and East Africa. In this third wave, every hour, 26 Africans die of COVID-19. The pandemic is still raging, and we must not let our guard down. As long as vaccination rates are low, severe illness and deaths risk staying high. Over 143 million vaccine doses have been received in Africa, and 39 million people, less than 3% of Africa's population, are fully vaccinated. That compares to more than 50% in the European Union and the United States. Equally concerning is a continuing inequity in the distribution of doses. Africa accounts for just 2% over the 5 billion of the over 5 billion doses given globally. This percentage, I'm afraid, hasn't shifted in months. It is encouraging, though, that in the past month, almost 21 million doses have arrived on the continent through COVAX. That's equal to the entire 4 previous months. As WHO, we're working tirelessly to support countries to hit the global target of fully vaccinating 10% of their populations by the end of September. We've just 1 month to go, and this must concentrate our minds in Africa and minds globally.
Now, in spite of these challenges, the WHO says some 9 African countries have hit the 10% vaccination target, but they've expressed concern about the new move of booster vaccinations by the developed world as a major threat to the African countries in their bid to fight the pandemic.
Already, 9 African countries have reached this target, so that's very encouraging. Among those are the island nations such as Seychelles and Cabo Verde, countries that have rolled out vaccines strongly from the start, such as Morocco, and countries where the uptake is rapidly increasing, like South Africa. Many of these countries are in the upper middle or high income brackets and have procured vaccines directly from manufacturers as well as receiving various vaccine supplies. For lower income countries that are relying mainly on donations, the situation is more dire. If the current trends hold, 42 of Africa's 54 countries, nearly 80%, are set to miss the September target, I'm afraid. 3 more countries, Equatorial Guinea, Comoros, and Sao Tome and Principe, will meet the target at the current pace. I think a couple of other countries as well, like Senegal, Namibia, and Botswana, if these speed up vaccinations, they too could still reach it. I do commend the commitment of national and local authorities, communities, and partners who are working hard to expand the rollout of COVID-19 vaccines.
11 dead so far following days of torrential rain in northeast region. The deaths occurred in Janga in the West Mamprushi municipality, Tamboku in the East Mamprushi municipality, Najong number 1 in the Nakbanduri district, and Kunufo in the Cherepone district. 3 of the deceased were struck by lightning. One when the boat he was using to cross the White Volta capsized, while 2 were swept away when they tried to cross a river during a downpour. 3 others got drowned in the stream while swimming. The regional director of the National Disaster Management Organization, NADMO, Mr. John Kweku Al-Hassan, who confirmed the deaths, said 16 communities in the Mamprugu Moaduri district had also been cut off from the regional capital, Nalerigu. Many people, the NADMO officer said, were unable to access certain social services. This afternoon, NADMO is launching Regional Disaster Management Committee. All right, let's speak to our Northeast regional correspondent who joins me via Zoom, Ilyasu Tanku. Good afternoon to you, Ilyasu. This is a dire-sounding situation, but NADMO is launching a committee. What exactly is the purpose and point of this committee?
Well, the committee is launched to coordinate disaster issues in the region. It has just been launched by the Deputy Director General of NADMO, Abu Ramadan himself, and that occasion has just come to an end. And so we now have a regional disaster management committee in the Northeast region, and it comes at the back of the torrential rains that continue to pound the region for weeks now. And as you said, about 11 people are dead so far. And the NADMO themselves, the National Response Team, are currently camped in Wale Wale. As I speak to you right now, the NADMO team have visited the zip line service in Wale Wale, and their mission is to ensure that medical supplies and other public services are able to reach some 16 communities that have been cut off right now in the Mampurgu Muaduri district and other parts of the region. The NADMO is also currently in communities along the waterways of the White Volta River, trying to help the residents to evacuate to higher grounds. We continue to experience more rains as the days go by, and it's really a very difficult situation right now for the National Disaster Management Organization. So as I speak to you right now, the committee has been inaugurated and they are expected to go into work at once to ensure that disaster issues are coordinated and and to ensure that responses to disaster issues are attended to.
Homes and property, those whose houses have been submerged. What's their current situation? Where are they being housed? What are their needs? And how is NADMO handling them?
Well, I just had an interview with the DC for the Mampurgu Muaduri district, Mohamed Abu Adams, and he said that those communities still remain inaccessible. They are not able to go in there to see what is happening to the residents trapped in those communities. And so it's still unclear what authorities are doing. However, the NADMO director have also said that they have managed to reach some of these communities and they have been able to make some assessments as well. And so they are putting together relief items and they are also monitoring the situation. He says they are not really in bad situation, but there are others that have not been able to, the others that the NADMO officials or authorities have not been able to reach. So these people, we don't know their state now, but the NADMO says those communities that have been able to be assessed, they know that the situation is not that dire, and they are hoping that the rain will stop going forward, or possibly we will not have the Bagre Dam speed.
Forgive me, Ilyasu, but it sounded like you were saying that possibly the Bagre Dam will not be spilled. Is that right?
Right. And so that they can take control in the Mampurgu Muaduri. Many of them currently remain.
Right. We're working to re-establish our connection with Ilyasu Tanku there.
Yes, Koja, I can hear you.
Oh, fantastic. I was asking, it sounded like you said that the authorities are saying that perhaps the Bagre Dam will not be spilled. Is that correct?
Well, that's their hope, really. And because according to them, the dam was expected to be still somewhere last week. That didn't happen. And so they are hoping, that's their hope though, they are hoping that we will not have the spillage. And the reason is because of the damage that has already been caused by the torrential rains. This is just a hope, a wishful thinking, of course, by the disaster management authorities in the region. But they are also saying that they are ready. They are also saying that they are ready for any eventuality.
Right. That's actually interesting because my understanding is that there is a committee of Ghanaian and Burkinabe officials who are in constant contact with each other when it comes to the Bagre Dam spillage. So we ought to know by now whether or not it will be spilled. It sounds as if we are guessing. Anyway, let's stick with the situation where you are. So at the moment, for those who NADMO has been able to reach, for those who have lost their home and property, what has been the arrangement in terms of resettlement? Has there been a need to resettle any of them?
Well, that arrangement, NADMO is here to clarify that particular arrangement. And like I said, most of the communities remain inaccessible. The DC said they are not able to reach much of the communities that have been cut off. But the NADMO officials are also saying that they have been able to reach some of the communities. And these communities that I say that NADMO officials are saying that the situation in those communities are not that dire. But like I said, there are others that have not been able to be reached, some of the communities that have not been able to access. So as I speak to you now, we don't know the state of those people in these communities, Kojo.
Right. Ilyasu, thank you very much for that update. And that's our Northeast Regional correspondent, Ilyasu Tanko. Away from the Northeast, floodwater took over some major roads in the Asante region following early morning rains on Thursday. Now, for almost 2 hours, commuters were stuck at home, bus stops and in traffic, as some streets and suburbs were flooded. Affected areas include the Kwamo Ejisu stretch of the Kumasi-Accra Road, and Ohiming Teria joins us now via Zoom to give us what the situation is at the moment. Ohiming, it's been a few hours into the day now. Is it still raining, and are there still people stuck?
Not really, Ekojo. The situation has improved, and now there's no more rain or downpour in the Kumasi city. But I must say that yes, traffic is picking up. Commuters and motorists have some reprieve to go back to their normal duties. So the roads that were inundated with flood waters, obviously the waters have subsided, and now the motorists have access to the roads, so there's no interruption as we speak. But I must say, in some areas, for instance, at the South Junction stretch of the main Kumasi-Obuasi Road, the sort of potholes created by the flood is very visible, and motorists are forced to spend some time thinking about whether to use these potholes or probably meander their way around the pothole. So that is the situation as we speak now. But I must say, yes, the situation has improved. Motorists now have access to these roads. The roads that were affected are the main Kumasi-Accra Road, especially at the Ejuso-Pamo stretch. And then on the Kumasi-Obuasi Road, the Bekwa roundabout to Santase roundabout road, and then the main Kumasi-Tamale roads were all affected by the flood today.
Right. Now, this is not going to be the last of the rains. What is the plan that the authorities have put in place to ensure that citizens who are stranded today will not be stranded tomorrow?
Honestly, this question, I'm not too sure I'll be able to provide, adequate response to. For instance, in most of these areas, it's not been happening overnight. It's been an annual ritual that anytime it rains heavily, these areas experience the floods waters. So, for instance, at the South Junction, motorists and commuters, and even those who live around, tells me it's been an annual ritual. Anytime it rains, because they complain of the size of the storm drain, the authorities have constructed pavements under the storm drain. And they say because it's too small to accommodate the heavy flow of water, that is actually accounting for the flood. So they expect authorities to provide everlasting solutions. But unfortunately, what they have done over the years is, for instance, about a month ago, when the area experienced a heavy downpour and there was flood in the area, it removed the asphalted overlay from the road. So what the authorities did was to bring in some chippings or gravels just to cover the areas that have been taken away by the flood. So this hasn't solved the problem. For residents, they've been complaining that the better way to solve this issue is probably to construct a new bridge over this storm drain so that it will be able to accommodate the heavy wave of water that passes under it. So until this is done, they are not too sure this situation can improve. And for instance, on the main Kumasi-Ejuso Road, there are concerns over what used to be waterlogged areas that have been filled, and people have now encroached and put up structures, buildings, and what have you in these waterlogged areas. And these are some of the reasons that people cite for the floods that we are experiencing in this area. And so I'm not too sure, and they themselves, the residents who complain, are not too sure when this can be eradicated, when the impediments put in the way of the water is still are still there and continue to pose a danger to the people.
Right. Now, we understand that the Ashanti region was undergoing a rather intensive vaccination drive. How have these rains and flooding affected that?
Yes, the vaccination exercise, the ongoing AstraZeneca vaccination exercise, has had its share of the heavy downpour today. Many of the vaccination centers, which had to start, the exercise around 8 a.m., were affected, and they were pushed to start as late as 11 a.m. And in some instances, got people who managed to go to these centers early on time to queue for them to be vaccinated, complaining that this shouldn't have happened. But in most of the centers that I visited, you could see that though people had come to be vaccinated, the vaccination officials, the health officials, they themselves were not available because they had to contend with whether the tablets that have been provided, where they used to queue people's details and all that will work. So it took them time before they were able to be convinced that the tablets and the apps were ready for the whole exercise to begin. So when I spoke to the regional health authorities, the Deputy Regional Health Director in charge of public health, Dr. Robson Michael Ejay, did indicate that the exercise has suffered a major setback, in the entire Ashanti region, for which reason the health authorities are planning to extend the vaccination exercise beyond the 5 days, stipulated 5 days or the mandated 5 days that has been given to them to finish the exercise. So what it means is that if the exercise, for instance, what we witnessed today, is anything to go by, then we are likely to see the exercise being extended beyond the weekend. So residents in Kumasi and Ashanti region, I must say, will still have the opportunity to be vaccinated. So this comes with a window of hope for those who want to be vaccinated, probably queue up in these places, but will not be served on time.
Did Dr. Roxanne Ejay give any indication about what protocol is in place in case there is more rain? Can we expect the vaccination to stop each time there's heavy rain? Or will they find a workaround so that the vaccination can continue, rain or not?
He did say that these are acts of God, and these are, circumstances that are beyond the control of the health directory. There's nothing that they can do. Anytime it rains and probably the systems go down, what do you do? The best you can do is to wait and then allow some time as far as the issues are concerned. So for the health directorate, in as much as they continue to experience this sort of challenge, the indication is that the exercise is likely to prolong. They will give some more time for people to have that opportunity to be vaccinated. And nonetheless, they believe that probably it's not likely that it will rain almost every day. So once it's disrupted today, tomorrow the exercise is bound to continue freely and smoothly. So they expect that residents will continue to visit these vaccination centers and get themselves vaccinated.
Right. If you just joined us, we're talking to Ohiming Teria, our correspondent in the Ashanti region. He's giving us an insight into the effect of the rains on life in the region, particularly the vaccination drive. Now, earlier, Ohiming Teria spoke with an assemblyman for one of the affected areas. Let's find out what he learned.
When there is a heavy downpour, this situation causes a whole lot of problem for the people of South Central and even those using vehicular transport or using their own vehicles to pass through this channel. There is a link road connecting South Central and North Central. Because of the architectural design, they have closed that U-turn, causing a very big problem. most of the times when this U-turn was there, all the drivers, when there is a heavy downpour, they pass through Palmer Road, go straight to that point, do the U-turn and go to where they are going. But because they closed that channel, it has been a problem for the residents and those using the cars, and it's very worrisome.
In terms of the floods, I know this area gets flooded anytime it rains. How common it is, and what has been the impact? How does it affect movement of people, movement of vehicles, and then the offices around here?
Oh, really? If there is a heavy downpour early in the morning, to be specific, movement is slowed. No one can pass through this channel to where he or she is going. Seriously, you will see a heavy traffic here. Both sides, vehicles cannot even pass because the last time it rained heavily, when you get into it, maybe like it will be on your shoulder or wherever, and it's there was a time one lady, a certain lady, I think that the water wanted to take her away. Yeah, and we helped. Through those who are doing this washing bay here, they helped, they swam and brought the old lady out, and it's very bad. And we are pleading to the government to come to our aid and sort things out here.
Right, so that was a South Centreso official speaking to Ohime Interior. Now, for a small community located in Kisima, flooding is the norm. Many residents in the area have lost their belongings as a result of frequent flooding that occurs there. My colleague Judith Awachitano visited them and reports that residents are living in fear as the meteorologists warn of more rains in the coming days.
This is what residents have to go through anytime it rains here in a small town in Kisima. Now, this area is basically flood prone, and when it rains, the water can get up to my chest. Like you can see on a wall right here, the level of water gets up to this line whenever it rains here in Kisima. Residents are worried about their lives and property, as many have lost their belongings to floods here.
The last time it rained, I saved a lot of children there because the water almost swallowed all the children, like about 5 children. So I have to carry them on my head, then bring them one after the other outside. So it's a bad experience to them. So we are not living comfortable there because whenever the rain falls, we find it so difficult to come out.
As soon as the water is coming, we make ourselves alert so that no one will get any risky in the area. So we make sure everybody in our rooms, we make a counter. If the water is coming, everybody pack his things on the counter, because if the water is coming, then we lock our doors, then we leave the place and go to other street to wait up to 1 hour or 1 hour 30 minutes or 2 hours if the water is gone, before we came back to clean the houses and our room before we can enter.
This gutter starts all the way from Ibri in the eastern region and ends at Odona at Circle here in Accra. But whenever it rains heavily, the water overflows and in turn floods the entire community. Residents here are calling on government to help solve this situation. Reporting for JoyNews, my name is Judith Awachitano.
Judith Awachitano with that report there. Right, there's more to come on The Pulse. It's the place to be. Stay with us. We're back after these important messages.
Hello, my name is Nathaniel Atto. You can catch up with all the fun and inspiration on the Joy Sports link here on Joy 99.7 FM, together with all other shows over and over again. It's very simple. All you need to do is go to myjoyonline.com/podcast and relive all of those fun moments over and over again. Joy 99.7 FM, your radio for discerning listeners.
Joy 99.7.
You're welcome back. Now, the Ghana school feeding program is arguably one of the most important social interventions by government to help boost enrollment in public basic schools. The program, which was initiated by government to boost the needs of basic school children, is merely limping along as the release of funds for the smooth running of the program is not forthcoming. Listen to the Public Relations Officer for the Ghana National School Feeding Caterers Association, Carolina Ewusi, who has been speaking at a conference.
We want it to be increased to 3 cities. The 1 city given to us with a 3 pesewas deduction, which amounts to 97 pesewas, is not enough to prepare food for the children. We are pleading to government for an increase to 3 cities.
Right, we're going to get someone to speak to us on this all-important issue of the school feeding program. But of course, it becomes one of the biggest pillars, not just for basic education, but for government's flagship initiative, Free SHS. The school feeding program is meant to bolster enrollment and ensure that those who travel from remote areas do not have to worry about feeding as an expense as they enjoy free basic education. A public relations officer for the Ghana School Feeding Program, Siba Alpha, joins me now on the phone to help us understand what the problems are. Siba Alpha, thank you for your time. Your caterers are raising concerns. They say that funds are not flowing, and so the whole program is limping. What do you say to that?
Well, thank you very much. We have somehow a contrary view to that, because if you recall, just 2 weeks ago, we did make some disbursements to the caterers to offset the first term of 2020-2021 academic year, which was supposed to be 67 days. So that one went for 40 regions out of the 60 regions. So there are 2 regions that are yet to receive their payment. That's Western North and Western regions. And even that one, as I speak to you, we are working to also make the payment. So the only areas we are left with for now is the second term of the same academic year that I said. And then the ones that I made mention of, the first term, we also have some isolated cases of payment issues. That one have to do with errors on the data for some caterers who have submitted wrong e-switch numbers, because we transmit the money electronically on their e-switch cards. And so when we're collecting the data, we realized that some of the caterers submitted wrong e-switch numbers. So there was a mismatch between the names of the caterers and then the names of the name on the e-switch card. And then some also apparently were using the defunct bank's e-switch numbers. And so we thought that if you transmit the money, the money will be stuck there. Nobody will go and claim it. And so we thought we should work on it and then pay them. So that's where we are now. We are working on it. We have even finished working on it. I'm sure by next week they should be able to receive their money, including the Western and Western North regions. So that's where we are now on the payment.
Well, it sounds like you're actually confirming what has been said. There are indeed arrears from what you're telling us.
Yes. Incidentally, we are always in arrears because it's a pre-financing program.
Yes. So how have these arrears affected the delivery of the program?
So the caterers are supposed to pre-finance at least for a term or more. So let's say 2 terms. And so by all means, we are always going to be in arrears.
So the caterers have agreed with you, signed agreements with you that they will pre-finance for 2 terms before government pays them?
Yes, at least for 2 yes. They are aware of them.
So at the moment, how have these arrears affected the delivery of the school feeding program?
Well, in a way, because we know already at any rate we are going to be in arrears. So we have prepared our minds that every now and then we'll be in arrears. But that doesn't mean that we should delay in the disbursement. And so that's why we always tell the kids that they shouldn't use the arrears as pretext to offer maybe substandard meals to the children. And so far, I think they have been doing well. They are doing their best to give them the quality food that we want them to give them. And so it's in a way, we will not say it does not affect the program entirely. But as you know, a sharp intervention of this magnitude, definitely there will be some little challenges here and there. And so we have that challenge. That is the frequency of the payment, the way we would have wanted it to go regularly to the caterers. That one doesn't happen as we would have wished.
So, Mr. Alpha, what I'm asking you is that how has it affected the delivery? Do you have schools where the delivery has slowed down? Do you have schools where the quality has reduced? Do you have schools where the children are not getting the food? Do you have these instances occurring across the country?
No, generally, what we have is some places, when we go on monitoring, sometimes we see that the caterers are not giving some few, let me say, not very few places. You see that you have to tell the caterers to up their games in terms of the delivery, the quality of the food. But generally, some also complain that because they don't have money, they are not able to cook. But we tell them that before you take the contract, you should know that you are going to pre-finance. And this is not the reflection of the program entirely, but most of them, generally, they are doing their best.
So the head of the association, who says that the delays have affected their work, are you saying that she's making it up, Madam Carolina, who says that their work has been affected by these delays?
No, I did concede, but tell you that in some places when you go, you see that the meals the caterers give to the kids, the peoples, the beneficial peoples, it's not up to scratch. I think I mentioned that. And so these are some of the challenges we get as a result of these delays in the payment. But I'm saying that generally, that's not a reflection of the entire school feeding program. Generally, most of them are doing their best. It's not everywhere that you go and see this situation.
Okay, so it sounds like you are suggesting these are just isolated incidents.
Yes.
So let's hear from the lady herself, Madam Carolina Ewusi, who is the head of the National School Feeding Caterers Association. Let's hear what she actually said.
We wish to encourage our hard-working honorable minister to put in a lot more effort to make sure that the second term payment is paid, and most importantly, to increase from 1 cedi to 1 cedi 50 pesos instituted. We the Caterers Association are very much concerned about the welfare of our members. Thus, the said payment will go a long way to help the caterers.
Okay, so those are her concerns. It doesn't sound like she's describing isolated incidents, does it?
No, I don't think she also said the whole program is going through that situation. From what I heard her say.
She's calling on the authorities to address a dire situation. And she's talking about how these delays are causing the members of her association to be unable to live up to their side of the deal. So that is not isolated incidents she's describing, is it?
And she did also say the whole country is suffering as a result of that.
Neither did I. Neither did I. But I'm saying it's not isolated, is it?
I did tell you that, yes, we would have wished that the remittances come as early as possible to be able to pay the caterers. That is an issue that we are, discussing with the government to see how best we can get the remittances released in time so that the caterers will be able to go and procure the food items and feed the children. That one has been going on. And some of these caterers, they have been working with us for years, 5 years, 4 years, 3 years. So they know the processes of payment. And then we also appreciate their concern. That's why we have assured them that we are working together as partners to be able to resolve this. So they understand us very well.
Okay. So what is government saying? What is government's explanation for the delays?
So normally, we normally apply to the Ministry of Finance through the Ministry of Gender, our supervisory ministry, for the release of the feeding grant. And you know how things are. There are competing situations. And so that's why we tell them that we pay as and when funds are available. And that's exactly what we have been doing. We apply as early as possible so that we are able to get the funds and pay.
Right.
But sometimes we encounter these delays. Then when the money is delayed, we send the delays to tell them that, we would have wished to pay them this date, but because of the delays, they should bear with us. We are working to resolve the issue. And so they understand how things work with us.
Right. Now, they are also calling for an increase of 50 pesos. Will that be doable?
Well, on our part, we did submit a proposal to government through the Ministry of Gender for the consideration of upward adjustment for the feeding grant. And so we are waiting for the feedback. We have been given positive signals that the government is considering the proposal. And very soon we will get the feedback, which I think will be satisfactory to all of us.
Thank you. Thank you very much, Mr. Siba Alpha, Public Relations Officer for the Ghana School Feeding Program. Now, processes for the registration of land in the country should not exceed 1 month. That's the target set by President Akufo-Addo to the newly constituted board of the Lands Commission. For him, the success of the board will be measured by how far it is able to implement this objective. Inaugurating the newly constituted board of the Lands Commission, the president said dishonest sale of lands, poor record keeping, and fraud continue to hamper the administration of land. He warned government's quest to develop the country will be difficult if the challenges identified are not addressed.
Use suitability or capability, and also advise on and assist in the execution of a comprehensive program for the registration of title to land throughout the country. The Lands Commission is the only independent body, constitutional body, whose membership is such that the appointing authority has no influence on the composition of its members. As you are aware, apart from the chairperson who is appointed by the president, all other members of the commission are representatives of professional bodies, the regional lands commissions, ministries, agencies, and the National House of Chiefs, nominated by the bodies themselves. This is so because the framers of the Constitution appreciated the importance of land to the socio-economic development of the country. All human activities revolve around land, and thus access to land is one of the most important factors in the development of every nation. Regrettably, despite the various interventions by successive governments, most of the challenges in our land administration still persist, including dishonest sales of lands, poor record keeping at the Commission, encroachment of public lands, and the fraudulent registration of land. For example, why should the same parcel of land be registered in the names of different people when the same Lands Commission is responsible for registration? Why should documents or files submitted to the Lands Commission mysteriously disappear when the Lands Commission ought to be the chief custodian of such important documents? Why should it take years to register just a plot of land? Our quest to transform our economy, to bring about the much-needed development and prosperity, cannot be achieved without effective land administration. Investors will be frightened away if they spend good money to acquire land as a major tool for production, only to realize that what they acquired is litigation that spans years and sometimes decades. Another disturbing issue is conflicting judicial decisions on the same parcels of land. For example, in several cases, beginning with Inri Ajakonte acquisition, Klu versus Ajiman II, 1982-83 Ghana Law Reports at page 852, delivered on 15 December 1982, through to Ajay Osei and others versus Ajay Few and others, 2007-2008, Supreme Court of Ghana Law Reports, 499, delivered on 7th May 2008. The same parcel of land has been held to belong to the Shiashi stool, the Klana Quarter stool, the Odate Chewe family, Numu Nmashi family, and the Osei family. This naturally will create problem for registration of lands. I'm, however, encouraged to learn that the new Minister for Lands and Natural Resources, the dynamic Samuel Abujinapo, Member of Parliament for Damango, is engaging the Chief Justice on this matter, and I urge all of you to give him maximum support to help ensure that we find a lasting solution to the problem. We cannot continue with business as usual. We must pursue institutional reforms necessary to anchor efficient land administration. These must include reforms in personnel, processes, and the working culture of the Commission. Fortunately, the Lands Act 2020, Act 1036, which we worked so hard to pass last year, gives us a good foundation to achieving these reforms. The Act has far-reaching provisions which, if implemented, will go a long way to build the effective land administration we desire. Key amongst them is the establishment of customary land secretariats to see to the management of stool, skin, family, and clan lands. Restrictions on large-scale disposal of family and clan lands without the concurrence of the Regional Lands Commission. The power of the Commission to survey and demarcate land. The provision for electronic conveyancing. The detailed provisions for the compulsory acquisition of land, including the payment of compensation, the management and use of public lands, and the provisions for divesting of vested lands. It is your duty to ensure that the general public understands this law and its ramifications and abides by them. In respect of vested land,
now, the 17-member board, drawn from various institutions, are to lead reforms at the Lands Commission. President Akufo-Addo says the Commission must prioritize moving from manual record keeping to digital as a first step.
I'm happy to learn that a committee has been constituted and the processes leading to the recommendation for the divesting of vested lands have commenced. I expect to receive your recommendations as soon as possible and act on them. Chairperson and members of the Commission, as you take office, one of the things you must pursue aggressively is the digitization of the records of the Lands Commission. Most of the reforms needed to build efficient land administration will be within our reach if we're able to move away from manual registration to digital registration. We must therefore work assiduously to ensure that the digitization program works. Our target is to ensure that the registration takes a maximum of 1 month. And I dare say, the Ghanaian people will assess the success of your tenure based on how far this objective is attained. Let me also add that your duty to manage public lands is a very onerous one. These lands are vested in the President as trustee for the people of Ghana. As managers of these lands on behalf of the state, you must ensure judicious use of such lands for the good people of Ghana. It is important to note that no public land is vested in any government institution. The same will be contrary to the dictates of the Constitution. Public lands are allocated to government institutions, therefore remain public lands, vested in the President and managed by the Commission. Indeed, the new Lands Act prohibits the grant of any interest in land, in public land, other than user rights to any public institution. No public institution should thus deal in, grant, or allocate any land without the express approval of the Minister for Lands and Natural Resources, acting with my consent. The days when public lands were literally dissipated without regard for the public interest are over. Finally, let me remind you that you are an independent body established by the Constitution itself. But under Article 258(1), Clause E, you are enjoined to perform any function that the Minister for Lands and Natural Resources may assign to you. Similarly, Article 258, Clause 2, empowers the Minister with the approval of the President to give you general directions on matters of policy in relation to your functions, with which you are obliged to comply. Your independence is thus not absolute. You must exercise your powers and perform your functions under the general direction of the Minister in accordance with the Constitution. Chairpersons, members of the Commission, your various institutions have nominated you to represent them on this commission because they believe in your competence to execute the mandate of the Commission. The good people of Ghana have great expectations of you, and you should not disappoint them. I'm confident that with the variety of expertise that makes up this commission, and under the leadership of your experienced, disciplined chairperson, we will work to ensure that we build a land administration of which we can all be proud. I cannot overemphasize the importance of your task. Much of the future development of our country is reposed squarely on your shoulders.
Those are videos of some angry residents of Elubo in the western region who hit the streets earlier protesting the closure of the land border there. Clad in red and black, the residents held placards with inscriptions such as, "Open the borders now. Our livelihoods are under threat." It's been 17 months since President Akufo-Addo announced the closure of both land and sea borders as part of efforts to contain the spread of COVID-19 pandemic. You recall, last month, residents of Ketu South embarked on a similar demonstration for the border there to be reopened. Well, the residents of Elubo want government to, as a matter of urgency, declare the borders open. Let's hear some of them.
away. They have left us with everything. We don't have anything to do. Our children are in the house. They are not going to school. I have 4 kids, 2 at the university, 2 at the secondary level. But I can't look after them because the border is closed. And some people are eating. They are chopping money. We are still there in the house. We eat, we sleep. So we are begging the government to please open the border for us.
Your name?
My name is Veronica Samoa.
What are you doing? What are your concerns?
I'm a taxi driver at Elibu, San Fran. When they closed the border, since they closed the border, since the 23rd of March 2020, and they closed the border, all our cars have been sold because you don't have money to survive on. And since that time up to now, I'm telling you, people cross every day, day and night. People cross. The immigration are collecting money. Throw me. Anytime they are right now, if even the interior minister, you should discuss his step and come to Elibo. I'll cross him. The immigration officer will collect money and I'll cross him. But if you don't pay, they will just say the border have closed, but I have not closed. That's the definition of the border closer. The border have closed, but I have not closed.
Why?
Because people used to go and come every day. The immigration are collecting money, the police are collecting money with evidence. Not that I'm saying it with facts. Because I'm a taxi driver, because that's where I survive. Because the border have closed. If the people come, I'll collect them money. Before I close them, I collect them 15,000, 20,000. Anytime the immigration will collect 20, the Kanuma will collect me from. When you reach at the other side of the border, the FSC will collect Demi. On that place, the police will collect through me. When you reach at Norway, and the rest will be mine. Because of that, that's where I will survive on. If I will not do that, I cannot survive. How will I survive? So, since that time now, up to now, we have nothing else to do. So they should open the border for us. If the border will not open, if the Afghani should discuss if they can come.
We commend the government for the work done since the outbreak of COVID-19. The government provided relief items for vulnerable people in some parts of the country. Those of us in the Lubo didn't receive any of these items. The borders have been closed for 2 years now due to that, we have not been able to run our businesses. I went to the city to buy some items to sell, but we couldn't make any sales. We are unable to pay our children's school fees or even pay utility bills. We are pleading with the president to open the borders and put adequate measures in place to curb the spread of the virus.
Jomoro MP Dorcas Afotofe, who led the demonstrators, tells Joy News they have been forced to hit the streets as several calls to government for the opening of the country's borders have not been heeded.
We are doing this demonstration because the land borders in Ghana have been closed for way too long. It's been almost 2 years. Our people at the border towns are suffering. As you can tell, people are crying. People that went for bank loans cannot repay. Lives have been lost. Marriages have been broken. People are committing suicide. The whole town is getting into like a ghost place because people are moving out of this place. So people are suffering. They can't pay school fees. Marriages are just falling apart. A lot of things are happening. A lot of hardships. So we are doing this demonstration to tell the government that we should really pay attention and do something about the reopening of the borders because it's been closed for way too long. The airports are closed and even reopened, but the land borders have not been opened. And it's really affecting the livelihood of our people. We've done everything. As a member of parliament, I did a statement. I called on the interior minister to ask him about the closure of the border. Nothing has been done. So we are hoping that by doing this demonstration, it will help us. The government will really hear us to do something. And that is why we are doing this demonstration. It's a peaceful one. We are only pleading to the government, our father, our father, to do something because people are really and then you can tell a lot of people are crying. Things are happening. Lives are being lost and something is being done. After all, we were told that the reason why the land borders were closed was as a result of this COVID-19. And lives that have been taken away or that are dying more than even the COVID-19 out of frustration, anger and all that. So we are pleading that this is money that come from Ghana. It came from
Right. So that's the MCE for the area. Actually, no, the MCE for the area received the petition on behalf of government at Elubu.
If you feel like something is not good, you can always demonstrate. On our part, we're looking for something different, but that is what we also felt. And it's been very successful. When you know, the president, I'm not the president. Issues about border closure and opening is the sole reason of the president. And we did say, the Makano Hano, get the back of Tambo, and then also advice, be a better model. Whatever decision you have to take, I think the decision will be taken. It's in the interest of your mom and your friends. And your petition will receive this improvement, will present it as it is. Thank you very much.
Now, post-harvest losses account for 30 to 40% of food waste in Ghana, according to the Ministry of Food and Agriculture. Now, this week, the weak connection between farmers and buyers has largely been blamed for this. Fortunately, a mobile and web app seeks to solve this problem. The Kwafo Marketplace has been developed by the Institute for Scientific and Technological Information of the Council for Scientific and Industrial Research, CSIR. Now, on Tech Thursday, Love FM's Kwesi Deborah speaks with the scientist behind this innovation.
Kwafo Marketplace is an online platform for farmers, agro-input shops and marketers to sell their goods and services. There are two versions, an online version and a mobile app which is available on Google Play Store. The app, developed through the Modernizing Agriculture in Ghana program, is meant to prevent fraud and establish trackability. Engineer Michael Wilson is the head of the electronics division of the institute.
When you have yield, especially like the Planting for Food and Jobs initiative, how do you get that food to the table of the Ghanaian? Some of the food get rotten because we don't even know they have been produced in there. So the Kwafo Marketplace is a dedicated e-commerce platform for registered farmers. We are dealing with about 4,000 farmer-based organizations across Ghana. So these farmers are registered to sell on the platform. Registered because we don't want that platform to be like a platform where people can do fraudulent stuff and say, oh, I'm selling this, you pay and you never get your stuff. So all the farmers there are registered with FBOs, so we can trace the food you are buying. These farmers, after they have harvested, can advertise their produce on the Kwafo Marketplace, and any average Ghanaian, any consumer, any food processor, any marketer could reach them easily and get that food from the farm to the consumers. So the marketplace is the end point where the food moves from the farm to the Ghanaian table. And I believe we are heading towards that point where you can tell for sure that the food I'm eating is coming from farmer A in region B and was produced under conditions A, B, C, and thus I can guarantee the nutritional content of the food I'm eating. That is the Kwafo Marketplace.
A user should be a member of the registered farmer-based organization or be verified by the platform managers to be able to advertise on the platform. The application also has a feature which enables prospective buyers to directly contact the seller of any commodity before any transaction can be agreed upon. Mr. Benjamin Folicher is CSIR Insti Mark focal person.
And the person wants to sell his or her produce. When you go to the Kwafo Marketplace, over there you can advertise your produce, and then people will contact you, because over there we have made it in such a way that you can upload your goods there, your telephone number and where you are, so that buyers can reach up to you, and then you can bargain and then you sell.
The index page or the home page, you click on the Kwafo Marketplace and you are launched to the portal. There is a button for you to register. You put in your name, your phone number, and then you select the FBO, the farmer-based organization you belong to. Our operational team will do their verifications and be sure that you are who you claim you are. And once they verify you, they approve you. Once you are approved, you can start selling on the portal. It's as simple as that.
Reporting for JoyNews, Kwesi Debra.
Right. Now, with stories from around the world of sports, including the record-breaking antics of Cristiano Ronaldo, we've got sports coming up next on The Pulse.
Hello, I'm Dori Nando. You can catch up with all the fun on the Cosmopolitan Mix and on all our shows via podcast. Just go to My Joy Online podcast and search for your favorite show and relive those moments all over again. Only on Joy 99.7 FM, radio for discerning listeners.
Super Hits Radio. Joy 99.7.
Hans Mainsander here with sports on the Pulse. And Cristiano Ronaldo broke the record for goals scored in men's international football as he hit his 110th and 111th goals for Portugal in their dramatic 2-1 World Cup qualifying win over the Republic of Ireland. The 36-year-old scored 2 late headers to break and extend the record after he saw his penalty saved by Gavin Bazunu earlier in the game. Let's check out some of Ronaldo's top national team goals. Any more questions for when it comes to Cristiano Ronaldo? Difficult to find any more questions for him to answer. He continues to break the barriers even at 36 years old. He holds the record for the highest goal scorer in the men's international football. And that is some record, you know, to bow out. Remember, he will also be playing for Manchester United in the Premier League. Outscored Romelu Lukaku in the Serie A last season. Big things expected of him on his return to England. We'll be here to see how all of this does pan out. That's it for now. You can read more sports at myjoyonline.com/sports. I am Hans Mainsander.
Hello, my name is Nathaniel Atto. You can catch up with all the fun and inspiration on the Joy Sports link here on Joy 99.7 FM, together with all other shows over and over again. It's very simple. All you need to do is go to myjoyonline.com/podcast and relive all of those fun moments over and over again. Joy 99.7 FM, your radio for discerning listeners.
Joy 99.7.
Well, this is where we put a pin in it for this afternoon's edition of The Pulse. Of course, coming up next, let's talk showbiz. If you still want your fix of news, you know where to go. MyJoyOnline.com has all the headlines from around the world. So until we come back together again, thank you ever so much for joining us on today's edition of The Pulse. My name is Kujo Yankson, and I've had a good time. Have you?
Latif, how are you doing?
I'm doing great.
Okay.
How
Latif,
are you doing?
I'm great. Now that I'm gradually getting to know what can kill a man.
Hey, really?
Yeah, gradually.
Okay, so gradually. I'm getting towards the day.
Yes, gradually. I'm getting. Did you have people who will also come and hold you by the neck that you're owing me, even though they know the people didn't come?
Oh, of course, yes. A lot of people, a lot of the actors and actresses that we used then, I mean, they didn't understand the fact that I've come to ask. You have to pay me. That's it. Bottom line, you have to pay me. Bottom line, you have to pay me. I would also give credit to 2 of my main actors. Okay, so you know what? What happened was that from the 2011 to 2016, I had some few actors that have been consistent on my stage. I introduced them to stage. That is at the National Theatre in 2011 from the School of Performing Arts. And they've been so consistent. Every year they are behind me, back to 2016. And you'll be amazed who I'm talking about.
So?
Clemento Suarez.
You're joking?
Yes!
Okay.
And then Foster Romanus.
Wow.
They've been amazing. Yes, I introduced them in 2011 with Gallery of Comedies. They call it the Legon Comedy on stage at the National Theatre. And then they've been so Clemento has been on all my stage performances. I mean, he was actually playing the key role, the comical role, from 2011 to 2016. Yeah. So I would say that they actually also helped build the Globe brand, whilst we also built them on stage and gave them the exposure during those era. We work closely. We work closely with the National Theatre then, so which is under the sector minister, and we always almost invite them to every play we do. There is no day we won't.
Did you ever sort funds from them?
So you see, the preamble is there already. They will tell you the National Theatre is struggling.
Okay.
So even for them to give you the auditorium for free, it's something else. There are some days that we struggle because even some minutes before the show, the National Theatre is locked because I've not been able to pay for the auditorium. Minutes before the show is locked because we come into an agreement. I told them that, look, I'll try and get the money before the show. This is what I'm trying to do. But then maybe a day or two, I'm like, Charlie, it's not working. I can't get the money. Let's just do the show. I will pay bit by bit. Sometimes it's hell. We will drag and drag and drag, and audience will come waiting. So you realize that some audience complain and say, those times people were complaining and saying that our play starts late. Okay. It starts late because of what? Because the auditoriums are actually locked. We've not been able to pay for the auditoriums to be open. Yes. And we've done that like 3 times. Because you see, you try as much as possible to see how best you can get money to make it happen. You don't get. And then the only thing you do is come back to the National Theatre and tell them, we don't have money. Let's just do the show. We've prepared for it. Some of the audience are in. We'll make some few money after. We might not be able to pay all, but we'll pay bit by bit. You understand? That has been the story continuously. I mean, from 2010 to 2016.
Please, I learned he burnt a Bible. Can you please ask him if it's true? And if yes, why?
That's not true. That's not true.
I think there was a picture of Jesus.
So it was not Jesus. It was a white man who posed as if he was Jesus.
Okay.
So I've got an issue with, you know, Ghana and Africa and black people in general worshiping this image of Christ that's not his true likeness. Because I feel like for us to actually be true to who we are as ourselves, as black people, we should not be looking up to a white man who is positioning himself as God, because that's what's happening. And it's so sad that growing up, the first time I saw a white man was the Jesus poster. And I honestly thought that that was Jesus, but then actually it wasn't Jesus. It was just a white man who was posing as Jesus. So for me, when I saw that, it made me think that white people were like gods. So already as a child, I was programmed
you bowed to them.
Yes, I was already programmed to think that the white man was better than me because they don't sin. They're saints. That's God. Do you understand? And I feel like that's affected our decisions as a generation and as people in Africa. I feel like even our leaders, when they sit down around table with white people, they will obviously hand over everything to them because they will trust them more. Right. Because that we've been conditioned to think that whoever that's lighter is better. Do you understand? So to me, we need to tear down that false image of Christ and worship God in its purest form. We're not supposed to be worshiping false idols, but we've been doing that from early. And as Ghanaians, you know, like I'm also ubisa questions about Bodam, so okay, like it's those kind of things that stopped us from questioning things. But as children of God, we have to question things. You know, when you're walking around with your child, oh, Daddy, what is that? What is that? We're supposed to question things, and children are so pure that they question, and we have to stay true to that purity and question how we were brought up religiously, because really that picture of Jesus is not Jesus. I truly, you know, I'm a Christian, right? But I want to be a pure Christian where I'm worshiping God directly through Jesus, but not through that image. Okay. So for us, we were not just burning a picture of Jesus, of course, hell no, you know, or heaven no, should I say. It was burning a false image, you know, that's oppressed the people of Africa, because I feel like that's what's even caused people to bleach their skin to feel like they'll feel more pretty if they actually, you know, look to lighter. Do you know what I'm saying? I feel like it's affected so many ways in our decision making. It's affected our leaders. I feel like a lot of issues that we're having now, even when you see the churches and it has the white Jesus, that doesn't make sense because that's not Jesus. So why are we not worshiping God in its purity? Why are we worshiping these false images? So to me, that image was me trying to, you know, give a message to say that we need to stop because this is a false image. We need to stop worshiping this white image.
Okay.
You know, that's false. So it wasn't about. So, but people took it as if it was Jesus, and that's the problem, because for you to see that picture as Jesus means you're worshiping a false idol, because that's not Jesus.
Ghanaians are quick to embrace new artists. It's like a three-journey step for them, not all Ghanaians, I think most of them. The first step is, yes, we are happy to have somebody new in the game. It's like, yay, we have somebody new vibe, new energy, new flow. He's going to really get us there. Now, in between the journey, in the middle, I think they have some certain expectations from them, like, oh, he's grown followers now, and I think he's changing. Gone were the days when I call him, the phone rings one and he picks up, now it rings 3 times. And we a mistake. You start doing some free Salaka shows. Later, when you start talking about money, you say, hey, you know, he's growing wings now. We can't, no, it's not like they won't say we can, it's like patiently you see him fall off and they'll go like, yeah, can't say he will fall off. So it's like this 3-step mostly happens to most of these uprising artists. So it was an advice to the uprising artists like, yo, careful, because most times when they are counting your Ediafo, they are rather counting your Achacha. So you guys have to be vigilant. Don't be just all headful, and when it's coming like, oh, you're a new person, and you know everybody will be giving you a platform and everything. It has that 3 steps. We have been there. Some was able to, you know, saw through them. Some wasn't able to. So first one, it was an advice. And the second thing I said is that as much as Ghanaians are quick to embrace new ones, same way they are quick to relegate the OGs.
You, as in the consumer, should not be blamed for inconsistency from the artist. No public person, whether it's media or consumers, should not be blamed. Yes, you can be concerned and say, oh, Charlie, me see a guy with Nkacho or but on a real, let me just be blunt and be a little bit show some. I'm looking for a word. Really, nobody cares. And it is with everything. Let me give you an example. If a Hits FM shuts down today and they are not operating, will any artist call you people and say, why are you not operating? If you have a technical hitch and for the whole week, Mr. Logic and the beautiful Pandits and Andy and nobody is coming on, will any artist call